In the last video, we looked at how to deliver oxygen to our patients in the case of an emergency using the portable oxygen tank. Next, let's talk about how we know what level the patient's oxygen is at. We're going to use what's called an oximeter to measure the amount of oxygen in their blood. But before we get into that, let's talk about how oxygen moves through our body. So oxygen moves through our body using our red blood cells. These are also called erythrocytes. Erythro is red, cytes is cells. So our red cells. Each erythrocyte or red blood cell has 4 hemoglobin. The hemoglobin are what give it its red pigment, and it's how the cell carries the oxygen. So it's kind of like its book bag. And each one of those hemoglobin can carry 4 oxygen molecules with the cell, for a total of 16 oxygen molecules per red blood cell. And then how the oximeter works is it's able to measure how much oxygen is in each of those hemoglobin. It does this with infrared technology. Might sound familiar. It's also how our remote controls work. So that little red light that turns on inside of this is what's checking the hemoglobins. You're going to have the patient's finger put inside here, and it's going to produce a reading as a percentage of SpO2. Okay, so we've got these little portable ones that'll be in kits, or your office may have a device like this that allows you to check on all of their vitals, especially used for oral surgery or sedation. How we work this is we push the on-off button. It's green on this one, and it's going to turn on. And then just like our other little portable device, this has the spring clip that just goes on the patient's finger. This one you don't have to turn on. The device is going to go ahead and start checking the oxygen saturation for that patient. So mine right now is at 99%. It may have a hard time reading that if the person has nail polish or acrylic nails. So just something to be aware of if the reading is coming back low. It may be a result of their nails. For an average person, the reading is probably going to be between 94 and 98%. It's amazing and great whenever we have 98 to 100%, but it's pretty normal for that 94 to 98%. If the person has a chronic lung disease, such as COPD, it's not unusual for their readings to average between 88 and 92. But if they're a healthy person with no known pulmonary issues or lung issues, then we would want to see those readings at least 92 or higher. 90 or below definitely needs medical attention. People may start to have bluish lips and discoloration when their measurements are in the 60s or 70s. At 67%, oxygen saturation, that's when we start to notice cyanosis, and where we're really seeing a lot of the ashy gray or blue tone to the skin, which is a major indicator that they're in a critical state. So what does it mean if we have a deficiency of oxygen in our blood? If we have low oxygen levels in our blood, it's called hypoxidemia. But what this can lead to is hypoxia, which is a low level of oxygen in our tissues. If we have a low level of oxygen in our tissues, this can cause damage to the tissues that may be irreversible. It is a priority in an emergency to make sure your patient's oxygen levels are staying 90 or above to prevent hypoxia and permanent damage to the tissues, such as tissues of the heart, brain, and lungs. It's important in the case of an emergency that we're documenting the results of the oximeter on the log sheet. If you look here, it's going to have a place for us to, first off, make a note of the oxygen that's delivered. So it has a place to choose if it was done with what type of mask, ambu bag, mask, or cannula. Make a note at what liters per minute were used, and also indicate the start time and the end time of the oxygen delivery. Likewise, we want to document the readings from the oximeter in the place that's provided. Like mentioned before, it is a priority for us to maintain a high level of oxygen to the patient in the case of an emergency. I hope this video gives you the confidence to check the oxygen levels of your patient in the state of an emergency.